Great. So today's webinar is brought to you by CirrusMD. CirrusMD is a silver partner and longtime supporter of MHPA and our members. We want to thank them for their efforts in organizing today's session. I'm excited to welcome Carrie Keener, Vice President of Payer Relations at CirrusMD, who is moderating today's presentation. How can virtual care help create new innovations in the Medicaid space? With that, I'll go ahead and turn things over to Carrie and the panel.
Great. Thank you, Eric, and welcome everyone. Really appreciate your attendance today and just want to thank you, MHPA, for the opportunity to lead this virtual care discussion. Before we get started, I just want to start with a few introductions. As Eric said, I am Carrie Keener. I am responsible for CirrusMD's strategy and growth in the payer market. I have spent over 24 years in the healthcare benefits industry with startups, high growth companies, evolving technology companies. And my leadership experience spans strategy, growth, client delivery, member engagement. I will be your moderator for today's session. And what I would like to do is take a moment to have both my colleagues, Dr. Donna Baldwin and Natalie Pavela, introduce themselves. Donna?
Thanks, Carrie. I'm super proud to be here. Thank you, MHPA, and those attending. I've been a family medicine physician for more than 20 years and have incorporated virtual care into my primary care practice throughout my career. So super excited about this topic. And I'm really passionate about being there for my patients when they need me, and look forward to this conversation and certainly your questions about how virtual care can be innovative, accessible, and delivered in a very high quality manner. So you'll hear those words from me quite a bit in the next hour, but I'll turn it over to Natalie to introduce herself now.
Hi, everyone. My name is Natalie Pavela. I manage implementation and the day-to-day relationships for our MCOs and plan partners in CirrusMD's Medicaid book of business. Currently, that spans over 4 million lives nationally, and I've been instrumental in establishing Medicaid best practices for our clients to help drive member understanding and engagement. Grateful to be here today.
Thanks. Move on to the next slide and review a little bit about what we'll talk about today. So you are all familiar with, I'm sure, and trying to solve for many of the topics listed in today's discussion. Our healthcare system, continues to face great challenges. More people in the U.S. are needing care. Access to qualified providers is becoming more and more limited. Millions of Medicaid members are going to lose, unfortunately, their coverage. There's fragmentation in healthcare delivery, and that's creating a challenge in delivering longitudinal care. Care costs are rising, and there is an additional stressor on plans to deliver more and more reporting and to close gaps in care. So today, as I mentioned, we're going to be speaking with Dr. Baldwin and Natalie, and really thinking about, how can virtual care help to address some of these challenges. And while there's no one size fits all, we want to look at what has worked or what we're seeing working, and what are some of the innovations underway to improve the delivery to Medicaid members. I think that we can all agree that, post-pandemic, virtual care is here to stay. And I think the question now is, in what capacity? How can Medicaid plans best leverage virtual primary care to help solve these problems? And how do we see really virtual digital health, virtual care evolve over time? So with that, let's dive in. Next slide, we're going to start with Dr. Baldwin. I'd like to start with the access to care and equity in care. I read an article the other day that stated only 22% of primary care practices are fully staffed. And on top of that, 1 in 4 physicians plan to leave primary care by 2025, making it even harder to access a PCP in the future. We know that the Medicaid population faces many socioeconomic and logistical hurdles beyond just the availability of a PCP. So Dr. Baldwin, can you talk a little bit about how virtual primary care can augment the existing provider networks and help solve that access problem?
Sure. And Carrie, this is a super scary time for Americans. And this really hits home for me for sure as a family medicine physician. And I'm really excited because I do believe that virtual care can help. Medicaid plans can leverage virtual care to help with this crisis when they do it thoughtfully. So really, as you mentioned, access to care is really the place to start. It has to be easy for the patient, it has to be when and how they want to receive the care. And of course, it has to be a high quality experience. Most importantly, it really does have to connect and integrate with the existing healthcare ecosystem. We really all have to work together to make it work for the patient. I see virtual care as really helping the brick and mortar primary care practices. They could be the virtual front door or the digital front door for accessing healthcare. And we all know that Medicaid patients are complex and are often higher utilizers of the ED, especially when the ED may not be the best place to get really the care they're seeking. Which brings up last night I was working on the system and a patient came on. She was a Medicaid patient. She had complex medical history, including chronic pain. She was thinking about going to the ER, but decided to use this new service her health plan was offering. And we just started chatting. After chatting with her for about 15 minutes or so, really listening to her frustration with her pain, and more importantly, that she didn't feel like anybody was listening to her. We discussed, what the ER could possibly offer her, and we both agreed that probably wasn't the best place for her to go because she really wasn't going to get an MRI that she thought she needed. She wasn't going to get more pain medicine. She was already kind of working with her PCP on that. So we discussed getting her connected to a case manager with her plan. And, and oftentimes, if you're not satisfied with your PCP for whatever reason, let's get you connected with a new PCP. The case manager can often help with transportation and other socioeconomic and other resources to help. And the result was, I really didn't feel like I did much except give her the time and really listen to her. And the ability to do that and not have to be rushed was really helpful for me and certainly hopefully helpful for her. So how can creating an easy access to primary care services really is that first and initial step, having physicians that, take the time, even if there's not that quick fix that we can do, but really, but listening. But how can you set one up that actually is equitable, meaning that it does work for everyone, not just some of your members or your patients? So we wanted to understand this. In our model, were we providing equitable care, and what was that like? So we conducted a study with two different racial groups, Black Americans and white Americans, and looked across what they were coming on for, what conditions they were concerned about, how we were able to help them, meaning could we resolve it on the service? Did we need to refer them in? And what was their satisfaction with using the service? All of these three metrics were exactly the same between the two cohorts. What was really different was interesting and yet not interesting, because I think it's our healthcare data that we see in brick and mortar as well. So where they were different is what they would do if they didn't have access to this virtual care option. And what we saw was Black Americans would more likely go to the ER than to their PCP or urgent care. And this is really consistent, like I said, with the healthcare trends. So establishing a trust in the healthcare system is also something that I believe that virtual care can do by making it easier and really being there when the patient needs it.
Thank you for that. I think the equity piece that's really critical and important. Virtual care really works best when it works for everybody, right? And we want to build a system that works for everybody. So Natalie, can you talk a little bit about maybe some attributes that contribute to a successful virtual care program? Like what have you seen your customers focus on in terms of ensuring that your program is equitable and that is easy to access?
Yeah. Certainly, as Dr. Baldwin mentioned, I think access to care is a problem across the nation and something that our plan partners are focusing on, really care access, making things more available is kind of their top priority. One thing that's interesting is that Medicaid often requires a video to submit claims for telehealth visits. However, we know that video can be a barrier to receiving care. A patient may not have access to broadband. They may have data limits on their phone. They may not have the privacy to have that video conversation, or they just not want to do a video. So we actually have multiple Medicaid partners that offer CirrusMD as a value add benefit, kind of forgoing that entire claim submission process in order to allow members to use telehealth through whatever modality is most preferable to them, be that video, be it text, be it audio. So we really feel like this multimodal offering meets members where they're at the places and places the emphasis on how the individual feels most comfortable seeking care. So I think that's one thing that we've seen create more equity and be successful. In addition to access, I think our partners are looking to remove barriers for the patients with a telehealth offering. So whether that's, paywalls, administrative tasks, as Dr. Baldwin already mentioned, I think transportation has been something we see time and time again, or access to reliable transportation is a barrier for Medicaid members. So how do we make it as easy as possible for them to connect to a doctor? A couple other things that are top of mind, I think ensuring quality has been really important to our partners. So ensuring you're selecting a solution that follows evidence-based medicine and works to help close HEDIS or STAR gaps. And then kind of providing a personalized experience, having a tailored member experience is certainly key, whether that's for well child care, pediatrics in general, postpartum care, women's health, just to name a few. Cost effectiveness is also super important to our plan partners. We see many are willing to offer virtual care as a value add, no cost member benefit, just so the cost of receiving care is not a barrier to initiate that first step in their care journey. And then I would just close with, as far as learnings, we receive feedback from members that barriers to receiving in-person care could also be perceived biases. So some members struggle with issues such as racial or gender biases, and physically going to the doctor can be a really stressful or anxiety-inducing experience. And this is where virtual care can come and assist. I think offering this multimodal virtual experience that members can access from the comfort of their own home, we really hear has been valuable to patients. We hear Medicaid members also report difficulties in navigating both learning and the compliance and financial costs associated with insurance and Medicaid medical treatment. So how can your virtual care solution streamline that process? i.e., in the matter of 1 hour, can the patient sign up for the service, see a doctor, get treatment arranged, and provide an experience that really encourages them to trust this and other related medical services? We kind of see ourselves as a virtual front door for a lot of our partners. And, if we can provide a positive experience for that patient, it's an extension of your health plan or your brand and helps build trust in kind of the healthcare system as a whole.
That's great.
Yeah, and Natalie, I can't underscore enough underscore enough what I hear patients coming on the platform, and having that required video is truly a barrier, and they don't want to do it. They don't want to do it because maybe they don't have the equipment, but they mostly don't want to do it because they're not comfortable. They're a lot more comfortable in a text or a chat modality to share those very uncomfortable scenarios, to demonstrate, to really elicit some of their frustrations. And so I really hear that time and time again, especially in the Medicaid patients.
Yeah, the data plans and the using of data plans and broadband plans. Yeah. And I thought the call on the bias was interesting because, oftentimes we think about physical, logistical, fiscal barriers, but we really don't think about like the bias that people may feel on an in-person visit. And I think that's very relevant in the LGBTQ plus community. So thanks for calling that out. On the next slide, let's move on a little bit, and I'm seeing questions come in, so we will address those questions as we kind of move through the presentation. We talked a little bit about the primary care component, but we're also seeing a significant shortage in mental health providers. I know I'm personally on the strategy and the payer piece side, constantly being asked about, what are you also doing for behavioral health? And last week I listened to the MHPA webinar that Magellan did. So Magellan commented in that webinar that in the coming years, there is not going to be enough graduates entering the market to meet the behavioral health demands. and that we've really got to start relying more on the primary care or the PCP doc to fill that gap. Kind of scary because we have a shortage now. So it seems like that shortage is going to continue. Dr. Baldwin, can you elaborate on, the clinical relevance or importance of an integrated, primary care and behavioral health program?
Sure. And certainly, there's still stigma around behavioral health and mental health. And so, primary care is really an access point to that, and to be able to address some of those concerns and connect them with any in-network resources, whether it be therapy or cognitive behavioral tools or psychiatry as necessary. Because you said there's even a bigger shortage of behavioral health providers. My training as a family medicine physician actually includes caring for patients with mental health, and taking care of that whole patient is really core to what I do. And not just as an osteopathic physician, we're trained to always think holistically, but really, it really involves care of chronic diseases, involves care of even some of the simplest things. So a few weeks ago, a patient chatted in about needing her diabetes labs and refills of her medications. I asked her all the usual questions, including how her blood sugars were doing, and she said they're really not that good. And we started chatting about why. Come to find out that she'd been going through a bad breakup with her significant other and was feeling quite depressed for the last few months. The visit turned into a longer discussion really about her depression. We administered some standardized assessment tools like a PHQ-9, which assesses depression, GAD-7, which looks at anxiety, evaluating her for mood disorders and substance use. And so really looking at her mental health from a very holistic place as well. Not only did we order her diabetic labs and refilled her medications, but we started her on an SSRI or an antidepressant for her moderate depression, and connected her with those in-network resources that she had for therapy and the like, and then arranged for me to follow up with her because she is going to take her 6 weeks to meet with her new PCP, and I wanted her to be able to have some progression and some improvement in her care, as well as follow up with her labs. So we arranged for follow-up in a few weeks, and I would outreach to her. She was also welcome to come back if it was more convenient or she had concerns. So I just followed up with her earlier this week, and guess what? Her mood was better. She was already seeing a difference in her with the medication and some of the self-care tools we talked about. And likewise, her blood sugars were better. So mental health really shows up everywhere. And as a primary care physician, if I'm not equipped to manage bread and butter depression, anxiety, and stress, I truly won't make a difference. So it really is a role of primary care to take those initial steps, ask those questions, engage and be curious, and then be able to help with that wellness journey for the patients. At the beginning of the pandemic, as did most of us, we saw a huge increase in mental health needs and concerns. And so as an organization, we really pivoted and looked very quickly how we could innovate and design an evidence-based workflow and care experience to really address, evaluate, and initiate medication and create a follow-up program to really help patients. And then as per our nature, we wanted to measure it. We wanted to look at what difference we were making. And so we measured outcomes around PHQ-9s and GADs, so anxiety and depression. And come to find out, within a very short period of time, within 8 weeks, we made a very statistic and clinically significant difference in the lives of our patients. And I get goosebumps about this because I don't think I was doing that in brick and mortar. I don't think I had patients that had that much accessibility to me. I didn't have the time to do those follow-ups. And I see a lot of moderate to severe depression. A lot of patients do have suicide and suicidal thoughts and histories. And so really to be able to move those moderate and severe depressed patients that do correlate with those thoughts and certainly actions to a more well state, I really feel like I made a big difference. And as an organization, really feel like we made a significant investment and difference in these patients' lives. So feel really, really proud of the work that we did.
Yeah, I think having those tools and making sure a virtual provider has access to those tools and is leveraging those tools is really important. We had a question come in, but before I asked the question, it made me think about the conversation that you and I had last week about, you had mentioned that 80% of behavioral health encounters are able to be supported or resolved by the primary care, kind of what you just sort of talked about. So, this 80-20, want to understand kind of what the divide is, but the question that kind of plays into that is, how are primary care physicians partnering with mental health providers to contribute to that collaborative care model? So, thoughts on, and then any kind of thoughts on mental health consultants in a PCP office. But really just, the partnering component with mental health providers, I think kind of talks a little bit to that 80-20 conversation that you and I had.
Yeah, I mean, I think, a virtual care environment and system really does have to have, number one, the time to spend, right? It can't be a 15-minute, a 5-minute, or even a 20-minute visit. Some of these visits take longer to really do a full evaluation to understand exactly for that individual patient what's happening. It's also important as a primary care physician for me to set goals, to set share with the patient what they want to achieve, and then utilize those other support structures. So whether that be health coaches, whether that be therapists, whether that's in the virtual care solution or whether that's in the healthcare ecosystem. I think it's, we always have to work together and really utilize and maximize those resources for patients, because everyone's different. Some people are amenable to therapy. Some people want cognitive behavioral tools, but certainly as we designed our mental health approach, doing that in a very collaborative way with our partners, as well as with other specialists and other providers, I think is really important.
Great. Thank you for taking that question. Next slide. Let's move on. I thank you for everybody for submitting questions. Just keep them coming in, and I'll sort of bring them up as we go through. We're at the end. Just to kind of shift a little bit, let's talk a little bit about the role of virtual care in disease prevention. We know that longitudinal care approach is important in disease prevention, and certainly in developing care goals and treatment plans. Yet I see a lot of organizations procure programs in a more siloed manner, such as virtual urgent versus virtual acute versus chronic services, or even behavioral health programs and children's programs and women's health programs, et cetera. So in your opinion, what are the important or critical things to think about as plans procure and implement programs, whether it's to prevent chronic disease or close care gaps, and how much emphasis do you put on the individual programs versus, again, kind of the more holistic solution?
Sure. I mean, I think, certainly as a primary care physician, coordinating care is at the heart of what I do, and being able to have all the information to be able to work and coordinate care between those different solutions is really important. And certainly we need the help of everybody. And so it's really team-based care and how you do that. I think you can have too many solutions and too many silos. And so it's really important that virtual care kind of brings that all together, and then they all work together. So it really does have to be in a holistic approach. It's often very challenging for patients too, because they're like, do I go into this musculoskeletal care? Do I go into this mental health provider? And where do I go? What is primary care and what's acute care? As a family medicine physician, it's all the same. People will make appointments coming in to talk about their cough, and they end up leaving with tobacco cessation advice, right? In addition to treatment for their cough. And so my visits are not unique to a specific acute problem or a chronic problem. It's really looking at that patient as a whole patient and wrapping my arms around that patient. Because again, once they access you, you want to make sure that you are able to address all of those different concerns and get them connected to their in-person PCP and be able to have that be coordinated.
And Dr. Baldwin.
Go ahead, Natalie.
Oh yeah, I may just add, I think from the patient, kind of client perspective, as we're thinking about, chronic disease management and your virtual care offering, we know that caring for these conditions likely include multiple touch points with the patients. And so I think because of that, you want to be thinking about deploying a solution that encourages repeat usage and really streamlines not only that new patient intake, but that subsequent visits for the member. So even in my experience, I see that like roughly 40% of our Medicaid virtual care patients are repeat users. And for some months, we see repeat usage rate as high as 70% for some partners. So I think really keeping top of mind, having a virtual care solution that's easy for your members to register and initiate a care conversation will develop trust in a member benefit, such as a virtual care offering. And it's something that they'll be bound to use in the future in times of need. Dr. Baldwin has even shared with me in the past, while a doctor may not reach a certain level of depth with a patient on that first visit, as a patient's kind of getting acclimated to this new modality and kind of comfortable with it, we definitely see, and Donna, feel free to chime in, but as that trust and the modality evolves, you've started to see patients become more open, and just that ease of use and expanded access to care can help your plans, use this virtual offering even as a differentiator in the marketplace.
Yeah,
Absolutely.
And kind of this, so I've got a question here, but and let's move to the next slide, because it sort of sits between this conversation, or your response to this conversation or this question, and the next one. But the next slide of kind of fragmentation. We talk about all these different resources, right? So another kind of theme I see across, especially the Medicaid population, is the challenge of engaging people effectively and connecting them to the right resources at the right time based on whatever their care need is. And the health system, of course, is full of different ways in which a person can access care. You've got your urgent care and your PCP and your emergency departments, and there's all sorts of points of entry. And these are all great resources and great places to go. But oftentimes too many access points can result in a fragmented and overwhelming care experience. And particularly when a person is, in that height of need of facing a health challenge. So, Dr. Baldwin, I kind of want you, and I've got a two-part question because I've got a second question here for you, Natalie, but Dr. Baldwin, can you talk about the simplifying the member experience in a virtual environment? And I'm also going to ask the question that somebody raised in the panel. The person's talking about falls. And so the number one reason, for an ED visit is a fall. And in a virtual care and primary care, how is virtual care and primary care addressing the mobility and balance issues? And I think that kind of plays a little bit into right resources, right time, fragmentation of delivery. Where do you go? How do you get there? How do you simplify the process?
Sure. And I think you're right. I mean, I think of it as, a decade and a half or so ago, urgent care has popped up, right, all over the country. Here's a great, fantastic way for people to get, easy access on their time with a physician that can address all kinds of primary care needs in addition to urgent care needs. And the role of the primary care physician was kind of lost, and I felt it. So my patients worked all day. They were busy, they needed refills of their hypertension medicines or their asthma medicines. And they're like, oh, I'll just go to this convenient urgent care, right? And the urgent care addressed their needs. They addressed their acute needs, and they really took care of their refills of their asthma medicine. There wasn't this conversation about how many ER and urgent care visits did you see? Are you overusing the albuterol? It really just met that very acute need. And so it fragmented care, and the patient thought, hey, I'm getting really great care. And it's easy. So, as a virtual care offering, I think it is really important to see that patient as a whole patient, to do the right thing for the patient in the moment, but also then engage with them on prevention, engage them on, taking care of their blood pressure and their asthma. And are you on a preventative inhaler? Because down the road, that's what's really going to make a difference. And so really have to work together, really have to make that care experience easy for the patient, and being that virtual front door and being able to guide them can be really helpful as to when do you use the ER and when do you use this, and identifying folks that could be at risk for falls is an important one as well. SDOH and identifying the barriers to them completing that care that I'm asking them. Maybe I wrote for an inhaler that isn't covered by their insurance and we have to choose a different one. How are they being able to get back to me easily to make that happen? And then likewise, I think, and we didn't talk about this on the other slide, but how can a virtual care solution help close those care gaps and help close the the gaps that that you all are wanting, whether it's, HEDIS metrics around depression and anxiety, whether it's, AAP metrics and HEDIS metrics, whether it's fall metrics, could we help design programs that really reach that? And I think that when we looked at our behavioral health model, for example, we recognized that, in order for us to be able to provide data to our plan partners, we had to use certain ICD-10 codes that would satisfy HEDIS. We also had to include exercise counseling as a piece of it as well. And so, as we develop our programs and caring for our patients, they're all evidence-based, as Natalie said, and high quality, but they also look to HEDIS and what would need to be able to satisfy. Be able to export the data that we're collecting, whether it's blood pressures, PHQ-9s, G80s, those kinds of things, so our plan partners can utilize those to close those care and HEDIS gaps, I think are really important. But, Natalie and I work together implementing programs for a lot of our clients. And Natalie, talk more about kind of our client playbook and kind of what that looks like in helping us match resources with our patients.
Yeah, I feel like it's all about presenting resources to the patients at the point of care. So connecting them to the right contacts or member benefits while ensuring longitudinal care. Certainly each plan has different resources, and even across one plan, benefits can vary across individual states. So I would say, in my role, Dr. Baldwin and I work with each partner to develop a customized clinical playbook focused on key topics or needs that could present themselves during the virtual visit. So whether that's needing access to the member services contact information or a provider search tool if they are not bonded to a PCP or are, looking for a new one, we certainly want to help create those connections and encourage that bonding. The patient may need access to case management resources, or we want to be able to surface behavioral health tools that they have available through their health plan, prenatal care resources, guidance on tobacco cessation, and the list goes on. But we sort of think about all these different categories with our partners as they come on board to make sure that we have those customized resources to really ultimately help the virtual care solution be individualized for the patient. So I think to be successful, we can have all these resources, but how do we make it effective? And that the answer to that is really having it at the fingertips of the doctor to pass along to the patient at the point of care. So, on the back end, we're using artificial intelligence and machine learning to surface these resources to the physician during the visit. So it's something that, especially in a chat-based modality, when there's phone numbers, URLs, web links, these are things that the patient may not be calling member services right after the care conversation, but when they come back into the app the next day or 2 days later, they've got all of that documented and kind of have a plan of moving forward and where to go with their next steps.
Yeah, thank you. I think that, and actually just to take that piece and circle back to the one question around the falls and the ED, around, how does virtual care address the mobility and balance issues? A lot of what I've seen in our customer base, a lot of folks offer virtual physical therapy, MSK solutions. And in those cases, those are the types of resources I think that need to be serviced and need to be part of a collaborative care model. Any of those types of resources that are and guided by the doctor and guided by the physician. Donna, would you agree on that? And then I've got a second piece here.
Yeah, no, absolutely. I mean, I think, having those resources and tools at the fingertips of the physician at the point of care, as Natalie said, really using technology, and we're jumping ahead, but I think we're just super excited about it, but really using that technology to make the doctors more efficient so that they can spend the time talking and chatting with the patient, right? Because that human-to-human connection is really what's at core and what patients are needing, because they're all individualized. A cough for one patient is not a cough in another patient. It's interesting because, as I talk to our salespeople, they say, well, what conditions can you take care of? And I'm like, anything, right? Because we want to engage with patients. We want them to come to and ask questions. And if we can't resolve it on the platform, we're going to give them a place to go or a resource that's in which they can, and really to be able to maximize the resources, but also to use the resources as they're intended. Really, the cost of healthcare keeps rising because the right resources aren't being utilized. For example, the EDs, as we've talked about, right? There's plenty of things that we can do. And I think virtual care is a place to help you reduce those costs too. So, yeah, I definitely think that MSK is a big, I think about when you go to see a physical therapist, they give you a plan of care, but who's holding you accountable to that, right? You're gonna only do those exercises the day before you have to go back. And so really having a solution that can provide that accountability, and that's sometimes using health coaches. I think that's sometimes using, as one of the questions said, dietitians and others. And so, as our solution progresses and as we evolve, really identifying the needs of our patients, of our clients, and what does that really look like? But really leveraging what you guys already have. A lot of our payers have very good, rich resources. It's just getting them connected. One of my absolute favorites is the case and care managers that you guys have, who know the intricacies of your particular plan. And so being able to really work together to get those patients connected to what they need, whether that be transportation or housing, is really key at us being successful as well as you guys.
It's like you're reading these questions. I know you can't see them, but the health coach, the health coach that you just kind of talked about, and the connection to resources. Another question that came in is, and this is asking, I think, specifically about us, but we can certainly talk about it in a general manner. Do you have a referral network for additional providers to address the SDOH, such as registered dietitians, care coordinators, PT, transportation? Can you talk about, like, I think where I see us going with this is the importance of having that physician first, having that, still maintaining that primary care provider, but how do we also support these other things that need to be supported, quite honestly, particularly in this Medicaid population?
Yeah, absolutely. I mean, I think the first touch with the physician is core to at least what we do. And we believe strongly that, not having to go through, and think about when you make an appointment, right? You want to talk to somebody, well, you have to talk to the scheduler. What do you need to be seen for? And you explain your whole story. And then you show up at the clinic at the time and the nurse says, what are you being seen for? And you have to explain your whole story. And none of these people can actually solve your problem. So what would it look like if you actually got to the person that could solve your problem? And that was the first touch point. And so putting that doctor first is core to being able to achieve that and do that in a highly effective way and a cost-effective way, believe it or not. And then using that care team and those other supporting people to really to really augment that care and implement that care plan. A health coach can be instrumental in helping to identify SMART goals, to identifying barriers as to why they didn't utilize the referral that I gave them, and so many other different ways. So that care team as a whole is really important, and whether that sits inside a virtual care solution, or whether that sits in the health plan, I think really depends on what the needs are. If we all hear, do you build it, do you buy it? And really the key part of that is partner. And what does that partner look like? And is it truly a partnership? As Natalie was talking about, the client playbooks are very individualized. And some of our programs are very individualized based on the needs, based on the HEDIS gaps or the care gaps that have been identified. And so having a virtual solution that's flexible, that's engaging and that wants to be innovative, I think are really keys to making that successful.
Great. So I think we answered those questions that came in on that topic. Kind of moving on to the next, the technology. You started to talk a little bit about technology. We'll take it in a little bit of a different direction. We've kind of discussed some of the important attributes around parts and pieces and parts of a virtual care program that are used to support the Medicaid members. But if we can't reach the member, which is often a concern, it's kind of all for naught. So I know using technology to surface content and information and resources and that sort of thing is one thing, but how do we use, or how can we use, or Natalie, how have you seen your customers use the technology to increase member awareness? And what strategies, have you seen work in the Medicaid population? I know, because I know this is a really tough population to engage with and reach.
Yeah, certainly, Carrie. I feel like, with commercial or other lines of business, contact information is readily available. But as many of you may know, some of the challenges we face is just having reliable and accurate contact information available for Medicaid partners. Sometimes a plan may only have that for 10 to 20% of their membership base. So in light of this, I've certainly found, a multi-channel strategy is key when partnering with our Medicaid clients to increase engagement. From my experience, I'm going to share a couple effective marketing channels that we've implemented. Some of these are certainly technology specific. Others are more boots on the ground tactics that are key for this audience. But in terms of technology related, I think we see impactful results from email outreach to both unregistered and registered populations. If you can do that on a monthly basis to continually get in front of the membership base, fantastic. But even quarterly, and just having those regular outreach touch points keeps this program top of mind. And, a member may not feel like they need the service when they first get an email, but then the second time it comes, or, what do we hear? You need 7 or 8 touch points before something kind of settles in and you decide to take action. We've also developed sweepstakes campaigns with our Medicaid partners, delivering things like fitness related prizes. And that certainly helped encourage registration and first time app usage. So if budget allows, working with your virtual care partner, can they co-sponsor a campaign like that to help see engagement? And then, text messaging on a monthly basis has also been a really valuable engagement tactic on our end. We certainly feel like that both email and SMS should promote various program value drivers. So whether that's human connection, speed to care, cost effectiveness, various clinical use cases, as we've all talked about, ER diversion. So a member can kind of understand the different reasons why they may take advantage of this healthcare benefit. And then I would say leveraging technology for redeterminations, taking some of those typical marketing channels you're using and having them be used for kind of education on what's going on in the healthcare space right now. I'll save kind of details here. We'll dive into that in a little more on our last question on the next slide. And then using technology for good to set up direct referrals to, your plan directly from your virtual care solution. So as Dr. Baldwin mentioned, one of our Medicaid best practices is to have a direct referral line to the case management team within our health plan partners. They're receiving those daily referrals. They're able to follow up with a patient within 24 to 48 hours of that virtual visit and really help guide and shepherd them in the next step of their care journey and ensure, if there's in-person connections that need to be made, that those are happening. And then I would just say, for more non-tech related channels, it goes without saying, but ensuring your virtual care program is embedded and included in all plan-owned materials. So your member handbook, your portal, and featuring the program prominently wherever possible. Could downloading your virtual care app be one of the 3 key to-dos that you're recommending in a member getting started new member mailer guide? We think training and education for the plan staff is also really valuable, especially for those that are member facing. So your member services, care management, nurse advice line team, how is your virtual care solution embedded into the workflow of your call center? So if it could ever be of use, this is something that they're surfacing with your members that are also, already reaching out, actively looking for resources that could help them with their healthcare question. Having collateral that can be used by the community engagement team, I think, is also really valuable. Flyers, banners, magnets, mailers. We see plans that have these community engagement teams on the ground going to health fairs, going to state fairs. These are the ones, that they're talking to members, they're helping them download the app, helping them register and even start a care conversation right there in that moment. So I cannot speak to how valuable kind of those boots on the ground people are for a Medicaid population. And then I think the last thing I would touch on is, in-network provider engagement is also key. We've developed a provider flyer and hosted Q&A sessions to build partnership and understanding with the in-network provider groups for our plan partners. And really just help them understand we're all in this together to care for Medicaid members. We're here to extend their practice to 24/7. We're here to help them operate at the top of their license and provide a resource for high needs patients. And again, I think in those scenarios, when I'm able to bring on clinical partners like Dr. Baldwin to just have a physician to physician care, conversation, we see a lot of success from that as well.
Yeah, and I think it's really important to, leverage those relationships. I was working with one of our Medicaid partners last month, and we talked about a patient that I was seeing. She had diabetes, she had depression, she also had some socioeconomic barriers and burdens to her getting in to see her primary care physician. But it really involved me working with her, utilization of our health coach, but also connecting with her PCP to be able to make that connection, as well as her case manager, and to be able to do that really seamlessly. We were all kind of taking care of that patient together, and where it was able to meet that patient's needs, get her conditions managed, and then do the necessary follow-up in person, whether it was a diabetic foot exam, whether it was an EKG that she was due for, those kinds of things. That so really how we partner with all of those folks as part of the care team, I think, is really important. So you might say, gosh, this is really challenging. How do the physicians do this? How do you have time? And is this actually something that can be cost effective? Because we think that you might be thinking, gosh, this has to be really expensive. And the way that we leverage that is through technology. So making it easier at the point of care that the physician has the resources identified and to be able to seamlessly give those to the patient. So whether that's like Natalie said, using machine learning and AI to help do that really helps leverage the time that we have with patients. Additionally, using a modality like text or chat, it's not a one-to-one physician-patient relationship, right? I can see, multiple patients at a time, which allows me to take the time with the patient that I need. And so our visits last year averaged about 25 minutes per encounter or per visit. Additionally, patients can come back on and ask additional questions. The other kind of cool thing about the modality is that it's all there in writing. And so anything that I'm typing is considered a patient instruction, right? They can go back to it and reference, did she say 3 times a day or 4 times a day on the ibuprofen? And they can go back and reference that, which is really cool, or connect right back with us. Additionally, how we share patients in our provider group is one that's also unique because we can read each other's chats. We know exactly what was going on. It's not just a summary of the visit. We develop care plans within the platform, as well as maintaining medical information as well. So it's something that is cost effective and is something that that our physicians really love. In fact, we don't pay them on productivity, which is also huge, right? So being able to pay our providers to just take a shift and see patients and not have to worry about, well, I better hurry and get off because my 7 minutes is up and I need to get to the next patient because otherwise I'm not going to get paid to do so. Is also, I think, makes it so that our physicians really enjoy the work that they do. And again, we try to focus on making it efficient, making it easy to find those resources, making it easy for them to get to best practices and really to be able to focus that time and attention on the conversations with the patient.
Thanks. So what I'm kind of hearing there is that, the technology can be used in different, and it's used as an operational tool, but also used as an engagement tool. And I think that it's important to have the integration across both. And certainly the using technology can help to not just leverage efficiency, but also using technology to leverage all the information and content that is available that a plan offers a member, and all those resources, and being able to surface those. So technology is huge, obviously, very big component to efficiencies and communication. Natalie, and let's move to the next slide. You actually kind of brought this up. Speaking of communications, is the kind of the redetermination component. I think it is it's one of the biggest concerns that I've seen. Every time you open your Google or you look at anything on Medicaid, it's redeterminations are being mentioned, and certainly the concern of what's going to happen with the unwinding of the public health emergency. We know millions are going to lose coverage, and that's an incredibly frightening thought. I don't think many would think about how a virtual program can help with the education around redetermination. But, I believe, and I think as an organization, we believe that we're kind of all in this together. And really, anyone that's a partner of a Medicaid plan, the responsibility is on all of us to leverage our member touch points and to educate about the change in coverage. And any organization, quite honestly, and quite frankly, really should be thinking about how they're supporting Medicaid members, in getting the word out. But that's my public service announcement. But Natalie, can you, because I know you have worked with customers that have sort of brought this to your attention and said, how can you help, or what can we do? And how do we increase the communication around this? Can you give an example or two from your customers of what some of your customers have implemented to just, again, increase awareness?
Yeah, absolutely. I think, as we've already touched on, one of the challenges in serving a Medicaid audience is reaching members. And if plans don't always have that contact info or accurate info available for everybody. And so, probably mid-2022, around this time last year, one of my Medicaid partners already had an eye towards the future, was beginning to focus on messaging around redeterminations. That partner actually sees best-in-class Medicaid virtual care utilization around 4%. And so we developed a plan to use in-app messaging as another channel to promote their redetermination communications, because they already had a lot of their membership base using their virtual care platform. So what we displayed was actually in the app. It appeared before each care conversation, and the messaging has evolved over the years, over the past year, based on that individual season's focus. So for a few examples, in 2022, that focus was really on renewals. And our messaging was something like, don't forget, if you're enrolled in Medicaid, you must renew once a year or you'll lose your coverage. Renew today to continue accessing free member benefits, such as, this virtual care solution. And so we kind of use that as the value driver. We had a link, a URL where they could go directly to read a little bit more about next steps that they can take from the state website. And then in Q1 of this year, our in-app messaging evolved to focus on gathering contact info. So, changes were coming to Maryland Medicaid, and we wanted to make sure that their contact information was up to date so they can receive important notices on any changes in their health insurance. And so we had information on where they could log into their account or who to call to make sure all of that was up to date. And then finally, even with this individual plan partner, we even updated the messaging again in April to say, to be able to keep this coverage for your plan in Maryland, you'll have to renew your benefits this year. You'll get an outreach from Maryland Health Connection to send you a notice when it's time to renew. And, again, we've got a link and a phone number, so they have all of that information. Otherwise, they'll lose their health benefits. So what impact did this have? Over the past 12 months, we got redetermination information in front of over 3,200 unique virtual care app users for this partner. This messaging, as I mentioned, was surfaced before each virtual visit, and that equated to 1.3% of their current plan membership, which may sound small, but there may have additionally been residual effects from sharing of this messaging through word of mouth with friends and family members. So all that to say, I think every little bit helps. It's important for all of us, as Carrie mentioned, to service Medicaid members to think about what we can do to amplify the message that's being put out by the plan partners, and how we can, get that in front of the patients to help them take action and ensure that they're receiving coverage moving forward.
Yeah, it's definitely an area I know that I'm very passionate about. So I do like to stress the importance of kind of the education, and it's everybody's role. I think that is what we have for the questions that we have planned today. We have had another one come in. I don't know, maybe Donna, you can answer this one. It is, kind of how do you think of virtual care delivery will evolve over the next 1 to 3 years, just kind of the virtual care space?
Sure. I mean, I think it's continuing to evolve. I think some of the things we've talked about today with, I'm actually scared that it is fragmenting, that there's a lot of solutions out there that are going to continue to fragment the care. And I think to make it really confusing. Think about going to a restaurant where it's like a very extensive menu, and you ask the wait staff, what's good here? And they say, oh, everything's good. Just, pick what you're feeling like. Not terribly helpful, right? And so healthcare having all these options and all these different places to receive care. How does a patient navigate that? So I think, I think utilizing virtual care to help with that, I think is one solution. Providing a comprehensive type solution so that plans can, really integrate and really utilize what they have, I think is going to be really important. So I think that moving forward, we really need to be thoughtful about the care opportunities that exist, and make sure that our patients are A, using them, and B, receiving them in a way that they want, but also measuring those outcomes. Are we doing even mattering? Or are we just throwing money at things that are really not solving the problem? So I think a lot of work for virtual care to really help solve these impending, really horribly difficult challenges.
Awesome. Thank you for that. All right, so I think we are coming to the end. So before I punt it back over to Eric, just thank you everybody for attending. Thank you for the questions. Really appreciate that. Keeps the dialogue flowing. We hope that you found this webinar informative and are able to leverage some of the thoughts as you evolve your, your virtual care strategy. And my name is on there, my information's on there. So if you have any follow-up questions you would like to talk about, just reach out and let me know.
Took the words right out of my mouth. That was awesome. Thank you so much for that very informative and insightful presentation. Obviously, I completely agree that virtual care and member engagement is only going to become a larger part of the industry moving forward, and it's only going to become more significant. So as a reminder, you will be able to find a recording of this presentation on MHPA's YouTube channel. With that, we will go ahead and close out. Thank you again to Dr. Baldwin, Natalie, and Carrie, and the entire CirrusMD team for sharing their expertise on this very important issue. And thank you to all the attendees for joining us today. We hope that you found today's session valuable and informative. With that, we will go ahead and close out. Have a great afternoon, everybody.
Thanks.
Hi, everyone.